we know that the pandemic has been such a threat to the health and security of American families. And tragically, the opioid epidemic has grown. 40 states have reported increases in mortality. Overdoses have spiked by about 18% during the time of the pandemic. And I just wondered if you could share from your perspective, for so many families, being together, being in close quarters with family members has been one of the first times they've realized that a loved one has a substance use disorder. Where should those families start in looking for help?
I got involved in addiction through my nephew, and his name was Trone, and he was addicted to a number of different drugs and eventually died at the end of 2016 of a fentanyl overdose. And so during that period, I spent almost 5 years, my wife and I, working with him because his parents had split up and it kind of landed at our doorstep through 5 arrests. So we can see a lot of the criminal justice system impact on this. And that's sort of the third leg of this stool. And the other 2 pieces are mental health. As you mentioned, everyone's often suffering codependence, around 70%, depression and anxiety. Then the third piece, of course, is addiction itself. And, throughout America, we're treating addiction, like a crime, and addiction's a disease. And we've got to change our construct of how we think about this so we can help folks. But when I went to help him, and I have resources to do the help that's needed, but when I went to do it, my wife and I struggled. We didn't know exactly who to call, where to go, because it's navigating, a very confusing system. So we put together one piece of legislation, and we appreciate your support on that. It's been great. And that is the Family Support Services Addiction Act. It's all about the family because we're a lot focused on the individual in the throes of addiction, but around them is a mom, a dad, a brother, a sister, children, grandparents. And how do we help them? How do we help them navigate this system and provide them the support?
Very much like our response to the pandemic, no one thing is going to get us out of it, but if we layer, using masks and good hygiene and testing and tracing, and hopefully soon a vaccine, we're going to be able to move us forward. And it's same with the opioid epidemic. There are so many layers of care that we need, and we have to take away the stigma that somehow if you are taking medication and that is helping you rebuild your life, that you are not truly in recovery, you are not truly addressing your substance use disorder. And we appreciate your work in saying we wouldn't deny insulin to a loved one who has suffering from diabetes, and this can be part of treating a whole patient. And I think that form of treatment has also been difficult to approach in the pandemic. And you touched on that we have a shortage of mental health providers and access to treatment. One sort of silver lining that has come out that can kind of brings together these 2 issues of, whole patient treatment and the pandemic is telehealth. And what do you see the role of telehealth in helping us address the needs of people?
Yeah, I spoke about telehealth and telemental health at all of my stops yesterday. And of course, the importance of broadband. I mean, 3 of my districts are very rural, and the broadband is put the haves and the have-nots and pull us apart because folks cannot keep up with their teleeducation. But telemental health is a success story. I was just talking on the phone with a CEO literally a half an hour ago, and he said they had about a 10% no-show rate for typical mental health visits. Now with telemental health, those rates are down to 2 to 3% max. So folks are making sure they go to their appointments, they're being there, And the other area, which I heard about yesterday at one of the addiction centers, was the barrier to make that first step.
Yeah.
When the person decides, I'm in crisis, I'm going to go help myself. It's hard to pick up, drive somewhere, move to a physical location and walk in that door cold and say, I need help. But it's a barrier removal when they can do telemental health. So we've got to get the reimbursement rates and continue like we've done with COVID and keep those Medicare, Medicaid reimbursements rates the same for televisits as they do in-person visits, because this has been a tremendous win